Hello everyone, this is Julian, Paddle Master Coach, and today I'm going to be talking, and actually it's not so much talking, but I'm going to be interviewing an expert on paddle elbow, also called tennis elbow. I mean, that's the injury that you get on your elbow when you're playing paddle. So I'm going to interview him, and he's going to tell us what's the proper care, what to do, how to prevent it, and all the great tips for you guys not to have paddle elbow. Some of my students that they're suffering from paddle elbow, I'm gonna now explain what is the proper, how to get it and how to prevent it. But we're gonna have Diego Mantero. He's a sports physical therapist for the Miami Heat and many famous athletes. And I'm going to be interviewing him, and he's going to give you some great tips. The most important thing when you get tennis elbow, right, or paddle elbow, you're here. So the elbow, you can get it on the inside of the elbow or the outside of the elbow. Most of the time when you get it on the outside is because you have a problem on your backhand side. And when you have it on the inside, you have a problem on the forehand side. How can you tell that? If you press here, you're gonna feel the pain right here, and if you press right here, you're gonna feel the pain right here. Diego's gonna give us some great tips, and I'm gonna leave the description right below for you if you need help with your paddle elbow and how to take care of it. I'm gonna leave the details at the bottom. Enjoy. Hello everyone, we're here with physical therapist Diego Mantero. We're going to be talking about the famous and that happens to all of us is the tennis elbow, or for us it will be the paddle elbow. He's going to give us some tips and details how to prevent it and what is the right procedure for you if you have it, try to get better at it. Please, if you want to introduce yourself, this is your clinic. What's the name of the clinic?
Select Physical Therapy. We're here in Coconut Grove, and we're going to talk a little bit about tennis elbow, just to guide you in the right direction. Basically, it could be many things, but the most common injury, it would be the inflammation of the extensors of the wrist. In the case of paddle, usually it has to be with the racket. Maybe it's not appropriate for your size or your weight, so that is important for you to check it with a coach. And then the other thing that is very important is the grip. It's another issue that has to be addressed, and also the coach can help you with that.
The grip meaning the grip too big or too small, or
it could be too big or too small, that it could really make a difference on how the elbow works.
So meaning if you have the wrong grip and you start hitting the shot, that could
because
impact
the pressure and the way that you action your muscles could really affect the elbow in that sense. Okay. So and the technique is also very important. If you start doing a lot of wrist motions, also that is going to affect the elbow and it's going to get inflamed, and then you carry on with that, it's going to get worse and worse. So that is important to take that in consideration.
Great. Sounds good. So what will be the preventive treatment if we get tennis elbow? What will be the best thing to do?
Well, the first thing to do would be start slowing down maybe on the intensity that you're playing. You don't want to keep irritating the area, so you're going to maybe play once a week or twice a week and see how that responds. Also add a few stretches to the
What kind of stretches?
The basic stretches will be stretch the extensors of the wrist like this. Just to feel, you're going to feel in this section there, so you're going to work on that area, okay? You can do it a couple of times a day for 15 seconds, and that will help a lot. And the other thing that is important is ice it a couple of times a day for 15 minutes, and then eventually if the pain progresses or doesn't get any better with that, you can just consult your physical therapist or your doctor, and then go from there.
Those elbow straps, do they really work or not?
If you use it properly, and that's why it's important to visit your physical therapist, because it has to be applied in the right position, on the right intensity, on the right pressure. So if you keep that in mind and ask your physical therapist, then you can use it and it could be useful.
Okay, so most important thing, it's eyes.
Eyes, rest, the stretches, and then consult.
The icy hot and all that really works or not?
No, I mean, you can use it a little bit before you play, just in case. But I think that the most important is go with your coach work on the technique, work with the stretches, and eventually in the future you can do some strengthening, and that would also help the process.
And what happens if he doesn't get better? I have one of my students, he's been complaining of paddle elbow, tennis elbow for the past 6 months.
In that case, I mean, I would send it to a physician that specializes in sports medicine, and then maybe you can do an MRI or something, just because there's a lot of things that it could be affecting the elbow. So when it becomes chronic, you have to get it checked.
Okay.
That's the best way.
So step number is the grip, technique, okay? That will be the two main issues pretty much. That's why it's so important to take lessons and having the right grip. And then if we have it, we have to put ice. And then what else?
The stretches.
The stretches, very important. Okay, good to know.
And then again, if he continues with pain, then send it to a doctor just to get it checked.
What kind of doctor will be the right doctor?
There will be a sports medicine doctor, specializes on hand and elbow. That would be the right person to visit.
Okay, awesome. Thank you so much. Thank you, guys. I hope it's helpful for you guys, and we'll see you soon.
We'll see you in the next. Thank you.